My first experience of a patient who died was on a ward as a student nurse, and she was a lovely lady. She was very young, she was in her 40s, and she had two small children, about the age of 6 and 8, two small boys. She was dying of cancer. I can't quite remember what cancer, but she, this particular day, she was very adamant she wanted to see her children. So they came in and saw her after school, and they spoke about their day and what they'd done, and she listened, and then she sort of said to them at that point that she'd always be there with them, and she loved them, and she gave them a cuddle. At that point, sort of gave them a kiss and just closed her eyes, and she passed. And actually her passing was lovely. It was really peaceful and really gentle. It was lovely. It was afterwards, obviously, the children and how they coped, and the distress that they had was just heartbreaking. She's a lady that I'll never forget. She will stay with me until the rest of my days. And I learnt from her that it's not just at that point when the patient passes that you need to be supportive. It's afterwards, it's with the family, and also, you know, your support and your care continues even once they've passed. When you go in and you make them presentable, you wash them, you change their clothes, still providing care and dignity to them. And that, in my experience, that actually it's an honour, it's a privilege, not a chore, to be able to be there for your patient at the end of their days and to give them that last bit of dignity before they actually leave you. It doesn't get easier. I think you learn to deal with things better because obviously with experience you do. But no, it certainly doesn't get easier, and I think we hide our emotions quite well sometimes, and 9 times out of 10 you come home and you cry a little bit and then you get back to work the next day. But no, it doesn't get easier, and the day it gets easier is the day that's it for me. If you don't talk about it, you're in denial, you get that sudden shock when it actually happens. So you do need to talk about it, in my opinion, but it is still patient choice. If they don't want to talk about it, you can't force them to. We just sort of encourage them to. But a lot of our patients are older, and it is a taboo subject. They don't want to talk about it, but it is something that we are encouraging, and we do bring it up, obviously delicately. But I think more now, people are starting to think about things and getting their affairs in order before that time actually comes.